Let's move on. Our next speaker is the Assistant Vice President for Watson's own brand health, exclusives, and business development. With 23 years of experience in top pharmaceutical and nutrition companies, she currently leads key initiatives at Watson's, including the expansion of Watson's Generics, the vaccination program, corporate partnerships, and hospital store development. We have the opportunity to hear today about how they are providing Filipinos access to affordable medicines with Watson's Generics and vaccination services through O+O channels. To let us know more, please let's give a warm welcome to Ms. Blesilda Espin. Good morning, Miss.
Hello, good morning everyone. So have you scanned the QR code? So you have to be very active this morning because I brought with me a lot of giveaways, samples for you to try, and of course raffle items. So now that I hear everyone laugh, I think I can already start my talk this morning. So to the UST students, faculty members, healthcare partners, and distinguished guests, good morning. Today, I am thrilled and excited to be spending this beautiful Wednesday morning with all of you. I am tasked to share with you relevant, timely, and thought-provoking topic on health access, which is also very close to my heart. For the next 15 minutes, I would like to request all of you to focus your attention and give your 100% participation. My hope is that these 3 key takeaways will be achieved at the end of my talk. Number 1, as students and future leaders, you should realize that having good health is crucial in your future success and happiness. Number 2, health access is a shared responsibility between individuals, the healthcare system, and the government. And as students, you are catalysts of change and guardians of innovation. And you have the important role to play in improving it. And lastly, you are stewards and leaders of tomorrow. The future is in your hands, and that is why as early as now, you can be part of the immediate solution. Before I formally start my talk this morning, I would like to share with you 3 hand gestures that I'd like you to use this morning. Kailangan active participation kasi hindi na kayo gumagalaw, guys. Okay, so number 1, please join me, okay? So first hand gesture would be the thumbs up. Can you all do the thumbs up? Okay, so this symbolizes that you agree with what I am saying. Okay, clear? Number 2. Okay, ito parang Gen Z millennial, the double raised hand. Okay, this one is sort of an exercise. So this is to show excitement and gratitude. And lastly, yung favorite nating lahat would be the heart. Okay, so this symbolizes love, support, and of course, your commitment. Okay. So bakit important yun this morning? Because what I will be sharing with you are things that you can already share when you go home. You can share it with among your siblings, of course your parents, and even your friends. Okay. So can we try the hand gestures first? Okay. So I'm going to say 3 statements, and I want you to have your version of how you interpret it. Okay. So the first sentence is, I brought with me some raffle items worth 1,000 pesos, which you can win later. Okay. So, what's your hand gesture? Mukhang may nanalo na, oh. Kasi si naka-jacket, talagang kitang-kita ko yung pag-double raised hand niya. Okay. Number 2 sentence. I also brought with me some Watson's generic samples that you can also try. Okay. Nasaan yung hand gesture? Okay, medyo active na din tong side na to. At saka to. Okay. Yung doon, hindi ko pa masyadong nakikita. Hopefully sa last, no? Number 3 sentence. Okay. The UST students are the best and the most beautiful people today. Okay. Okay. So thank you very much. Okay, so this morning, my topic is about bringing health access to Filipinos O+O. Okay, so later you will know what O+O means. Okay, so let me start off by defining health. Okay, so what is health? As early as 1948, there was already a definition of health. And basically, that definition talks about being complete. So the fact that you are physically complete, you have 5 fingers, okay? So that's how initially they have defined health. But nowadays, health is not just defined on the basis of being complete, but also on the basis of having physical, emotional well-being, especially associated with the state of being normal, meaning the function is working very well in terms of the human body and of course the absence of disease. But on top of that, I think what we also need to understand when we talk about health, it's also the aspect of being balanced. So meaning not just because you have the complete sensory, you can do everything, you're not sick, that means you already have good health. Nowadays, we also need to check whether our mental, physical, and also our emotional has this well-being. Okay, so we have to make sure that each facet or dimension of health is actually working very well. Okay, so why is this important? Because health is wealth. Okay, so who believes that health is wealth? Can I see hands? Okay, so why is that? Because I think during the pandemic, most of you are already doing your school at home, no? So it's very boring. But during that time also, we all realize and we are awakened by the fact that actually the biggest asset that we can have at that time is actually our own health. So can you imagine a lot of people dying and they're very rich, and at the end of the day, we are just very grateful that we are not that rich, but we are well complemented because we are healthy. And at that point in time, we believe that life is short, therefore we have to make sure that we live it to the fullest. And I think at this point in time, we also need to realize that that statement is still true. And why is that? Because, okay, good health is actually the most valuable asset that we can have. It is the foundation on which a fulfilling life can actually be built. So there are 4 important things that I want to give to all of you. Okay, good health actually allows us to live and enjoy life to the fullest. Can you imagine a classmate of yours or probably a family member who is not in a good state of health? So although this person is very talented, it's also very challenged in terms of doing the things that he or she likes. So just by being healthy, we realize that we can actually live our life to the fullest and enjoy it. And that in itself actually is a blessing. Number 2, healthy individuals are more productive and successful. And I myself experienced that. So sometimes there are high performer, extremely intelligent people, but end of day, they are always absent. At the end of the day, who gets the job done? It's the person who's always present. Sabi ko nga, diba? Being able to show up every day despite all the challenges is already a success. And sometimes we will get to the point that we will realize, yung classmate ko ang talino noong time na yun eh. Kaya lang lagi kasi siyang ina-asthma. So pagdating sa work, lagi siyang hindi nakakapasok. And sino yung na-promote? Yung tao na healthy, yung hindi nag-absent. So that in itself is already Okay? That goes to show that if you are healthy, you can be successful. Number 3, maintaining good health contributes to financial stability because you will not incur a lot of medical expenses. Imagine your parents being able to save that money instead of going to the hospital or buying medicines. Your parents will be able to give that to you para you can add to cart. Diba? Ang sarap nung ganong pakiramdam. And lastly, having good health allows us to live life and achieve more goals. Okay. So, what is then health access? So, this is one of the challenges that we are facing right now as a country, no? And you might be asking, ano naman ang pakialam ko dyan, ang bata ko pa, problema yan ng gobyerno. No, every one of us should be involved. Why? Because as I have mentioned earlier, you are the future of this country. And imagine that this health access can actually be your potential problem when you become parents later on or when your parents become elderly. And why is that? Because when we talk about health access, it actually means the timely use of health services to achieve the possible health outcomes, be it for individuals, community, or populations. And currently, there are 3 barriers to health access in our country. The first one is the rising cost of healthcare. Sabi nga, di ba, dito sa Pilipinas, konting galaw lang, meron na agad bayad. Okay? And the problem right now is hindi naman lahat ng tao will have access to free medicine, free doctor consultation, and even medical services. That is why it becomes now a barrier for everyone to have the access. Number 2, there's also shortage of healthcare professionals. So this morning we heard about Dr. Soliano. So Dr. Soliano is one of the top doctors that I respect when I was still part of Unilab. And most of our new products, siya talaga yung kinoconsult namin. And right now, the problem in our country is that because Filipinos are really very good doctors, nurses, pharmacists, and even dietitians or nutritionists, they are being invited to join other countries. So, ang nangyayari, tayo yung nagsasuffer, di ba? So, tayo yung nawawalan. And there's actually, the shortage is probably now, nurses lang. But I think in the future, and very soon, lahat na ng healthcare professionals, we will have shortage because Philippines is already 113 million. So you can just imagine how many doctors, nurses do we really need in the country as we increase our population. And lastly would be challenges. So this could be in form of time, of course. Right now, less work from home. Okay, there's also the problem of transportation because of traffic, because of geographical locations in the Philippines. As we all know, diba, we are more than 7,000 islands here. And then, of course, yung workload or sometimes yung capability natin to be absent just to consult our doctor. So these are the common health access problems that we are facing. Okay, so I'm from Watson's. So for the next few slides that you will be seeing, we will talk about how Watson's is helping solve the problem. Okay, so this is now the commercial side of it. So Watson's is actually a joint venture of SM Group of companies and AS Watson's, which is a global company based in Hong Kong. So we are the #1 health and beauty retailer in Asia, not just in the Philippines, but Asia, because Watson's is actually a global brand. And one good thing about Watson's is that we help in bringing health access. As early as now, we have the strategic vision. We know the problem, and we want to be part of the solution. So my goal this afternoon is to share with you how we provide solution and how we can partner together to solve the different health access barriers I have mentioned early on. Okay, so Watson's is actually a store with 1,175 stores nationwide. So we are now strategically located from Luzon, Visayas, Mindanao. And most of the time, we really pick the places where we think there's no a nearby store that can serve the community. So we have 4 different formats because we believe that each shopper has a different shopping mission. Okay, so what do we mean by shopping mission? For example, okay, sabi niya, I will go to Watson's to buy my mom's medicine. Sabi naman ni ate, ako naman, I will buy for my beauty needs. Okay, sabi naman ni lolo at lola, gusto kong pumunta ng Watson's, gusto kong magpa-vaccinate. So there's different shopping mission, and each shopping mission, we made sure that we have different store formats to address that. So meron kayong makikitang Watson's na sa dep store inside SM. We also have Watson's store inside the supermarket. Okay? We also have the Watson store in the community, and we have Watson store inside the mall. So each of the stores has its different purpose, and the purpose is actually to serve the Filipinos. Number 2, okay, I have mentioned earlier that one of our problems is the rising cost of medicine. And this is where Watson's now plays a crucial role. Back in 2002, we launched Watson's Generics. And the simple reason is that we wanted to provide options, cheaper medicine options for those who are struggling financially, or for those people who just really wanted to save. So what's the rationale behind that? Because end of day, what Watson's is pushing is actually compliance. Let me share with you a very interesting story. This is my personal story. So it happened sometime in 1998. I received a phone call that my mom was rushed in the hospital because na-stroke siya. So at that time, I was still in college, and I'm really like, what will happen to me? Because my mom supports my education. So matatapos ko ba yung college? So di ba nakakatakot siya? But at the same time, I'm also worried about my mom, mamamatay ba siya? So luckily, my mom survived. But you know what happened? Sabi ko, ano ba yung naging cause? Ba't ba na-stroke yung mommy ko? And looking at the real cause, it's because of compliance. She was not taking her medicine on a daily basis, and she has hypertension. So what's my message today? If you have parents with comorbidities, so what are these? Hypertension, diabetes, okay, cancer, COPD, kidney disease, all of these are chronic conditions, and they need to take their medicine on a daily basis because we don't know when will the condition worsen. And if your parents are not taking their medication, you can be in my situation. At that time, I would call it shattered dreams, no? So when I joined Watson's in 2023, the first thing that I did is to actually check the portfolio of products that we are offering, because we want to make sure that we serve the customers by doing it right. Kasi at the end of the day, hindi naman lahat ng generics quality. Diba? And there's the fear na baka hindi naman siya mag-work. But basing on my experience, and because nanggaling ako sa situation na ganon, I don't want other people to experience the same thing. So I really check the quality of products that we have. And I am very happy to share with all of you that Watson's Generics is actually a quality generic brand, and at the same time, it provides savings up to 80%. So kung struggling kayo financially at yung mommy nyo, parang mommy ko, iinom today, magsiskip mamaya, iinom bukas, skip uli, then that's the option that you can share with them. Mommy, baka gusto mong lumipat ka na lang, huwag ka nang mag-branded kung hindi natin kaya. Pero inumin mo yung gamot mo araw-araw. Okay? So, One thing I can share with you, the products that we have goes through a crucial 5-step QA system. So kung meron kayong if you know somebody who's struggling financially at hindi umiinom everyday ng gamot, you recommend Watson's Generic. We are the only company also that promotes compliance. Anong ibig sabihin nun? Kung good for 30 days yung bibilin, merong 30% discount. So, you can go home now and tell your mom and dad, wag na po kayong mag-skip ng medicine. Kung hindi natin kayang branded, you choose Watson's Generics. Okay. Number 2, medical services. So, as mentioned earlier, one of our problem nowadays is access. Malayo kasi, mahal. Okay, mamamasahe pa ako. And one thing I can share with you is that with Watson's, we know the problem and we want solution. We are now offering medical services. So if you go to Watson's store and you see the lady, okay, yung pharmacist namin, may nakalagay na vaccination services, you can avail the vaccination at a cheaper cost. Kasi sometimes, di ba, there are those people na wala namang sakit. They don't need their doctor. They don't need to go to their doctor. But if you have medical condition, of course, you can go to your doctor and have yourself vaccinated also. But not all doctors kasi are vaccinating doctors also. That's why we open our doors for vaccination program. So you can get vaccinated at Watson's. Senior citizens still gets their discount. On top of that, there are also stores that offers free medical consultation. So di ba may mga instances na hindi naman kaya lahat na magpa-consult sa doktor. So baka may kilala kayong ganun, pwede niyong sabihin, si Watson's may free consultation. Ate, kesa umuubo ka dyan, diba? Pumunta ka na sa Watson's, may free consultation. Okay, what else? Of course, meron din tayong free BP monitoring. So may mga cases kasi, who amongst you, may mga moms, dads, or grandfather, grandmother who take their BP monitors every day? Every morning, meron? Konti. Siya lang talaga yung active. May special price ka mamaya sa akin. The lady in red jacket. Okay. So, bakit siya important? You have to encourage your mom, your parents, to take their BP every morning. Why? Because sometimes our parents are walking bombs. Time bombs. Kasi hindi nila alam high BP na sila. Hindi sila umiinom ng gamot or hindi sila aware. So, my message this morning, wag nyo nang gayahin yung nangyari sa akin, di ba? My mom is not taking her BP every day. So, nung time na high blood siya, okay, she was exposed to a lot of stress at that time, and then yun, na-stroke siya. Okay, so, if in case meron kayong kilala, pwede nyong i-refer sa Watson's store to have their BPs checked. It's free. Okay. Next is O+O. Okay, this is actually for all of you guys. Why? Because O+O means offline plus online. Offline means visiting our physical stores. Okay, so if you have the time, the luxury of time to enjoy and go and move your body, then you can go to a Watson's store anytime, anywhere. But if you don't have the time, you don't have, you're so busy with schoolwork, your moms doesn't have ample time to go with you also, you can just go to the app. Okay, mommy, pwede kang bumili ng prescription medicine mo. Let's download the Watson's app. I-deliver siya ng free. And then, if you want your medicines na automatic na dumadating, mommy, i-refill nila, you just have to scan your prescription, load it to the app, and then Watson's can give your medicines every 30 days. So you can refill your medicines also at a discounted price. So that's how ready Watson's is in ensuring that health access is not going to be a burden anymore. And your generation can actually help the older ones, those who are not tech savvy, those who are not into apps. You can spread the news that this kind of service is actually available for them. Okay, and this is actually my favorite. I think before we close lang, I just want to introduce that I am joined by our senior brand manager for sustainability, Lexi. Okay, so Lexi is our lead for sustainability. And this is first among the retailer or the pharmacy drugstore in the Philippines. We are the only retailer that supports sustainability. And Watson's in support, we know that the generation will still need to enjoy what we are enjoying right now. So we want to be actively promoting sustainability. We do that by making sure that we produce products that are sustainable choices, okay, made from ingredients or from packaging that can be recycled. On top of that, we also support diversity. We also support different initiatives that will help and promote sustainability. That's through our people. So we are very active in doing tree planting, medical missions, and of course, later on, you will see the video of Watson's on sustainability. And lastly, in summary already, okay, hindi ko pa nakikita yung hand gesture nyo. Can you request for the hand gesture of everyone? Okay? Okay, so in summary, together with Watson's, we can help continue to improve the health access for all Filipinos by offering the following. For the rising cost of medicine, we offer Watson's Generics. For the shortage of healthcare professionals, we offer our health services such as vaccination, free BP monitoring, glucose screening also. And lastly, to address the busy schedules, the different challenges when it comes to transportation and also work-related issues, we have Watson's digital app, which is an O+O initiative. So together, dear students, friends, and guests, let's all work together to enhance and improve the health access in the Philippines. Thank you very much.
All right. Thank you so much, Miss Blesilda Espin.